Dear friends and colleagues of the ICS community, my name is Barry Bergmans. I'm a pelvic physiotherapist based at the Maastricht University Medical Center in Maastricht, the Netherlands. Besides this, I'm also a clinical epidemiologist and a health scientist, and my specialty is the conservative management of pelvic floor dysfunctions for females and for males. My contribution to Roundtable 8 about chronic pelvic pain will be related to bladder pain patients and what will be the sexual dysfunction in this patient and how physical therapy can interfere with this. What would be pelvic floor, management in this patient. And we will highlight for sure the contribution of the pelvic floor itself to this problem because it is very interrelated, these organ tissue problems with the pelvic floor itself. So the management, how to, to relax and how to make better bleeding in this area of the pelvic floor. So that will be very challenging because we want to see the evidence-based contribution to this. So we know because of the, the sensitization, where there can be cross-sensitisation of the organs like the bladder to also, the anal rectum, or to in females to the uterus, but also surely to the pelvic floor, not only the muscles but also the ligaments and the pelvic fascia. So there are trigger points, there are problems, there are higher tension in these areas that can be very well managed by very evidence-based pelvic physiotherapy. So in the team of the urologist, the gynecologist, also for sure the physical therapist has part in this. And not only because of the physical aspect, but also the social aspect, because physical therapists, they are dealing with the consequences of the health problem here, the sexual dysfunction in BPAS patients. So pelvic physiotherapy has really an impact on this. And because we see the patients several, sessions, we can have a very big influence on this, and this discuss in the multidisciplinary approach with our peers and with our, other, the other specialties. Now the ICS community coming to the lovely Maastricht, which is my home-based city, a fantastic city to be. It has a lot of hospitality, but not only in the social way, but also in the scientific way. Our Maastricht University Medical Center hosts the Pelvic Care Center Maastricht for many, many, many years. And here we have a real clinical practice based on evidence theory, which really has done a lot in the multidisciplinary approach of patients, adult patients, also adolescents, children. And having said this, the urologist, the colorectal surgeon, the gynecologist, the urogynecologist, psychiatrist, psychologist, sexologist, the pelvic physiotherapist, the nurses, they all work very well together. So we developed here our triage system. And this is something that we really here at this base want to contribute. This is also very interesting for the industry because doing this in the multidisciplinary approach, so many lovely industries have contributed to this field. Doing this together is such an important thing. And that's why you all have to come really to the ICS in Maastricht. You will surely not regret it.